Beautiful, full face there. All righty. Okay. Hey, thank you. Thank you for joining us again for Awesome Life Podcast. I'm Karen Stelch, your host, and I wanted to share with you this amazing guest. All of my guests are really so cool, and we end up being friends and colleagues, and Melissa is no different. Melissa, Dr. Melissa, and forgive me, it's Balizan. Balizan?
That's good.
Yay, I did it, more or less. Dr. Melissa Balizan is amazing. She is a #1 best-selling author. She is an international speaker. She does short talk TV star. I love the TV star. She has a passion for vitality, bringing out the vitality in others, working with her clients. The thing that has frustrated her is that treating the symptoms, most places they treat the symptoms, which is one of the reasons I love Dr. Melissa. And her desire is to uncover the root cause that are creating those symptoms. So as a consultant and a concierge pharmacist, she services and advocates for education and helping with the medical needs, the medicine needs that people could use in Eastern and Western medicine, combining them all. She actually has 52,000 clinical hours of healthcare experience. And by combining that Eastern and Western medicine, people can get to their root cause. And I don't know that we can say cure, but at least make a whole lot better. So welcome, Dr. Melissa Balizan. It is a pleasure to have you on the Awesome Life Podcast. Thank you so much for joining me. So tell me, how did this all start? You don't even look old enough to have 52,000 hours of clinical studies here.
Yes. Well, Karen, thank you so much. It's an honor to be here on the Awesome Life Podcast. I am delighted. And, 52,000 clinical hours, they wrap up pretty quickly, pretty fast. But I got into, I like to say medicine in a different, because it's healthcare, medicine and healthcare. And I went into it, if I go way back, so I'll tell you briefly. When I went to pharmacy school, I had a passion and I wanted to go into some form of medicine. And at that time, I was like, I don't want to be a physician. I don't want to do blood and all of that. Long story, that changed because I ended up running a couple of point of care clinics where people came in and I actually drew their blood. But I got into it. A couple of different things, I wanted to go in. I had some family members close to me who were dealing with some illnesses. And I was on a mission to find a cure for them. And because it was a newly diagnosed disease, people didn't know anything about it. And so I was on the path. I was like, I'm going to go into research. Things changed along my path. What didn't change was I was still able to help that family member. And what we did is we actually came up with a supplement regimen to help treat her condition and get rid of some of those symptoms. She's still doing great today. We've modified it. She's on some of the same supplements, but she's not taking any prescription medications for that particular disease. And this is kind of it's a blood disorder. It's a serious kind of disease. And what was very amazing and wonderful is that when I talked to her hematologist, which is a blood specialist, he liked the supplement regimen. He's like, okay, I can understand this. And, we looked at the science, we looked at the studies. That's one thing. I don't just take anything or just recommend any supplement. I want to see the science behind it. But that's one of the things that spearheaded me going into pharmacy school. The path that there's a world of opportunity available. And a lot of people don't realize this, that they think that pharmacists just dispense pills. And there's so much more to us than that. And so I went in, I spent my career, most of my corporate career in institutions, hospitals, and working ambulatory care. I ran a couple of clinics. We did outpatient care where people would come in and do screenings to see if they had high cholesterol, see if they had high diabetes, and then if they had a blood condition where they needed to be on a blood thinner. I ran a clinic for that as well. Did a lot of different things throughout my career. Throughout that, I was always on the passion of optimizing their health, optimizing their medications, making sure that whatever supplements they were on was the right thing. They were good quality supplements, that they weren't taking medications that were interacting with other things. So throughout this, my 52,000 plus hours, and I transitioned and went out on my own. And so that's where I became just a concierge consultant pharmacist on my own, because I am my own CEO now, which is awesome. But I still have that passion to optimize and do more, because I think that our current healthcare system is more of a sick care system. It's going in, you get treated for your symptoms, and we don't really get to the root of the problem. And so, I learned that along the way. I had my own health journey in amongst those many years. And that's kind of where my pivoting point was. I said, you know what? I don't see myself getting to where I want to be in life where I was working. I knew that my mission was bigger than that, and I could help so many more people by going out on my own and having my own issue with going to physician after physician, because nobody could figure out what my problem was, until I finally got to one who helped me get to the root cause of the problem. And mine ended up being pretty serious. I needed to have surgery to correct it. After I had the surgery, he told me, he said, you're going to be back in 6 months, because this is going to be a recurring thing. Because part of the root cause of mine was stress, very high level. And I was like, no, I'm not doing this anymore. My health is more important than this job, and I can help more people by getting to the root cause. And so that was really my hard transitioning pivoting point. And that spearheaded what I'm doing now, is because I do think that everybody deserves to be seen and heard.
Mm-hmm. Mm-hmm.
That doesn't happen very often in our healthcare system. You go in, you see your physician. Now, we have great physicians out there. I'm not discounting physicians. But what happens is that physicians don't have the medicine knowledge that a pharmacist does.
Right.
They have, on average, this is a fun fact, about 600 hours of pharmaceutical training, and they're allowed to prescribe. And yes, I do have over 52,000 hours in that same pharmaceutical training. And so I am the medication expert. I'm the supplement expert. So that's what I think sets me apart and pushes me to help people get down to that root cause and peel back those prescriptions. There's sometimes a need for prescriptions, but not always. A lot of us are looking for alternatives.
I think that is so true. And before we go much further, would it be okay to share the family member's illness that you were able to help with? Or is that not? I'm thinking, because our listeners might be suffering from the same kind of illness, and to be able to have you as a resource.
Sure. So it is, let me see if I can say the big long word. It's one of the myeloproliferative disorders. So there's 5 in those categories. And actually I had, when I think about it, there was actually 2 family members, but one more, essential thrombocythemia. So if you have essential thrombocythemia, or you have polycythemia vera, then those were two of my family members that I helped with supplement regimens. And often what happens is traditional medicine has usually put you on a chemo type of pill, even though it's not cancer, but because they didn't initially know how to classify it. So there's some things that can be done on those two disorders.
That is amazing. And the thing too that I have learned myself is that if you have these illnesses, prescriptions, usually all of them have a side effect, whereas the supplements in general help alleviate things without the side effects. Is that more or less, or?
Not 100% accurate, no.
Okay, good.
So supplements do have side effects as well.
Okay.
The thing with supplements is they've not been prominated to show those side effects because there's not some studies on them. There's some common side effects with both medications and supplements. Most people that have gone through in the studies that I've seen on supplements, and most people that go through trials of medications, because there's a process that gets a medication to market, nausea and vomiting are very high on side effects of both medications and supplements. And people don't realize that when they have that maybe upset stomach because they took that supplement, that's actually a side effect. So it can happen. It's maybe a little less likely, but I think it's more that it's just not publicized and popularized that we don't hear about it. But that's one thing that I do educate and teach on and caution people is that side effects can happen with supplements. Drug interactions or supplement interactions can even happen with supplements. One supplement may not play nicely with another supplement. So there's, a little misconception there. But the thing with bringing a medication to market has to go through many processes. Supplements don't have to go through any processes.
Yeah.
Most medications originated as natural things, a flower, a plant. And that's where your supplements originate, a plant, a flower. So there's similarities, but then we break off into how it got regulated, and sometimes it got manufactured or recreated. And even some of your supplements have been regenerated and recreated. So
yeah, absolutely. And you really have to be aware of some of those things. And I love the fact that you brought up, bless our doctors. Thank goodness we have them. The Western and Eastern medicine can work well together. And I remember there was a antacid, I guess it would be, for acid reflux that my dad had. And all of the things that were advertised and the doctor prescribed, like Prevacid and all of that stuff, didn't do anything. But we had found something that they have since taken off the market because it worked so well. And what they've done is made it prescription in a much higher dose that you don't need. And so I went to my doctor and I said, they're making this a prescription. Can I get this and cut it in half? And they said, no, just take one of the others. Just take one of the others because they're all the same. They're all the same. So I went to them and I said, no, this has this ingredient and that one has that same ingredient and that one has that same ingredient, but this is different. Can you tell me the difference? No, use the others instead. And I said, what? So what kind of questions should you ask about medicine and supplements? And does a pharmacist often, do they even have time to answer those questions?
That's a twofold part question. So maybe
nothing
even
like
three.
Putting you on the spot, Melissa.
No, that's perfect. Because I want to acknowledge what you did with your dad, because that's exactly what you should have done. You should have asked, and you did that, and your physician blew you off, and that's unfortunate. They should not have done that. They should have said, hey, I can look it up, or recommended you talk to the pharmacist who was more of an expert. There's a lot of questions that pharmacists should be getting or physicians should be getting. So when you're given a new prescription and you go in and you see your physician and you walk out the door with a new prescription or a new supplement, something that you decide, hey, I read this on the internet, I'm going to try it, or my girlfriend told me to take it or something, you should be asking yourself, okay, what is this going to do for me? What is it treating? Is it just covering up a symptom? Or are we actually trying to get down to that root cause? Is it really going to help eliminate whatever I have? Are there any side effects? And if so, what are they? What can I expect? Are there interactions, drug interactions, food interactions, supplement interactions? There's a whole list there. Those are some key things. How do you take it? What happens if I miss a dose? What happens if I don't take it? What happens if I experience one of those side effects? These are all things that should be asked. They should be discussed with you. And I can tell you that unfortunately, they're not. Number one, the physicians use
paper.
Just a long sheet of paper. Yep. The physician doesn't know. The pharmacist typically doesn't have time behind the retail pharmacy counter because they are pushed by higher up, quota, quota, quota. I've got to get a certain number out because of all the different different things that go along with how much a pill it costs and what actually the pharmacist gets paid, what the pharmacy gets paid. And that's unfortunate because most pharmacists have a true caring heart and they want to be there. They want to answer your questions, but they're also strapped for that time because there's 10 other people behind you in line. So when you go up to get your prescription, if you have questions, the pharmacist is going to answer them for you. But the thing is most people don't know what to ask.
Yeah.
And you get a piece of paper that has, okay, here's all your side effects. You go home and you got to get your magnifying glass out to read it because I think they're getting a little bit better, but most of the time it's like 8 to 10 point font and it's 4 pages long. And you're like, do I really want to read this? The doctor just told me to take it. And yes, I want you to have faith in your physician, but I also want you to question. I want you to be a part of your healthcare process because it's you. That physician isn't taking that medication, that supplement. It's you. It's your body. How's it going to affect your kidney? How's it going to affect your liver? Can I drink alcohol with it? That's a question that comes up. Can I drink milk with it? Can I drink orange juice? There's certain medications. General rule, most medications don't mix with alcohol. Just saying. Just saying. But there's other beverages out there that are not good for certain medications. They make them act less, which they're not going to do their job. Sometimes they potentiate it, which makes it act better than what it was. Some other medications can make the other medication act better, which means you're getting more of it in your system than you really need. Wow. And so there's a lot going on behind that. So you can get more in your system that you need. You can also have interactions where you get less in your system. So your doctor gives you a pill that's 10 milligrams and you take it and we're expecting a specific result by you taking 10 milligrams of that pill. What your physician may not know is that you're taking supplement A, which interacts with your 10 milligram pill. And even if you told your physician, they may not know the interaction because they're not, unless they've gone and extra educated themselves on the meds and the supplements, because that's not common knowledge to know certain things. There's some certain things, yes, but supplement interactions are not common knowledge. Yeah. It's not something that is often taught. It has to be learned after the fact often. Now, one of my things is I've learned about supplements throughout. When I started, I was lucky. I had a curriculum where I learned about that, and I've kept up with that practice with treating clients and patients throughout the years, because people come in, they hear about something. And the good thing is they would come into my clinic and they would say, hey, can I take this with my other medications. We would go through, we would do a review. And I would say yes or no, or let's adjust this or adjust this, and we would get with their physician if we needed to change a prescription medication as far as dosages, forms, so that we're all on the same page. But it's up to you as the end user, the consumer, as to what you put in your body. I'm not going to force you to put something in. Your physician can't force you to put something in. The only time that's going to happen is in emergency medicine and you're unconscious.
Yeah.
And they're going to do something in the best interest, and that's appropriate.
Yeah. Yeah. And indeed, the other thing that doctors don't always see that a pharmacist might, I think, is recognize that some of these prescriptions that are being given work best in a certain environment. So again, thinking about my parents, my mom was put on big prescription drugs, just so that she could be a little less stressed and anxious. And she ended up being in the hospital, and they said, "What are the drugs?" And I gave them the things, so they continued with those. She didn't wake up the whole time she was in the hospital because it was way too much for that particular environment.
Yep.
So and the doctors just kept coming to me and saying, "This doesn't make sense because she's sleeping all the time." And yeah, but those are the drugs that have been prescribed.
Right.
So having somebody like you to be able to go to learn all of this stuff. I love a concierge.
That's awesome. And yes, and that happens more often than I'd like to. It happens more often than I even recognize. Loved ones that are our parents, they're on medications, or you as yourself, you go into the hospital or you get put on something for stress to handle things at home. And then yes, something happens and you go into that other environment, and oftentimes things get continued, and they just get continued. And that happens a lot, because in a hospital, you're treating whatever is acute to you. So whatever your newest symptom is, and they're not there to treat your long-term conditions. So they just maintain whatever you were on. And that's standard of practice. So that's not wrong. But then sometimes you need somebody to step in and say, "Why is she sleeping all the time here?" Maybe even at home, it was not the right dose. Maybe things had changed there and it was too high of a dose. But that's thing. So when medicine, our healthcare system is specialized in certain areas, and in other areas, there's a lot of room for improvement, I say. So yes, having somebody that can sit down and look at that and review and figure out, okay, is this the right dose? Or are we just masking? Are we giving her one medication to mask the side effects of another medication?
Yeah. So there are probably a lot of negative results by taking a lot of different medications, I would expect, huh?
Yes, there are. There's a ton. Let me tell you about a client. When she came to me, she had been on a medication for 3 years. She had suffered for 3 years taking a medication that made her sick to her stomach, gave her diarrhea, which isn't pleasant. And she just kept taking it because they were trying to treat something. And when we had our initial chat, I'm like, I knew exactly when she went through her med list. I'm like, it's that drug right there. Let's change that. Let's talk to your physician. Let's change that so we can still help the condition that we're trying to treat and get rid of those side effects, because it's not fun to have a bellyache all the time. It's not fun to have to run to the restroom. When you're trying to hold down a job and you have to keep running to the bathroom every hour, your boss is going to be looking at you and wondering about your productivity and other different things. So there's better things out there. There's different options. And I think that when you go in to see your physician, there are standards of practice. Yes, you're diagnosed with A, we give you B. And if that doesn't work, we might give you C if we can get it past your insurance. So there's a couple of hangups in there. And there's different things around the process that sometimes we have to work around to figure out, okay, so we can get you the best care with the least amount of side effects, but there's alternatives, there's options, whether that's supplements or just a different medication sometimes. Because with me being both Eastern and Western medicine, and I do pull in that, my pharmacist, I spend a lot of money on that. I'm not letting that part go. It doesn't mean I'm pushing pills at you. We're wanting to make sure that you have the optimization of what you're taking. Is it the right thing? Supplements or medications? Because they're all drugs in my book.
Yeah.
And so, yes, but I felt so bad for her because for 3 years, she just put up with it because the physician just kept renewing it. And she didn't do anything about it. She said to the physician, but they didn't know.
No. There are other possibilities, aren't there? It's all about having that awareness, and which is, part of being awesome. You have to be aware and allowing the possibility that there are other options that are not known by a physician that a pharmacist might know, would know. And I, again, back to my parents, I took care of my parents for 5 years until they passed. And I was so grateful to our pharmacist, because the pharmacist would actually call and say, hey, you know what? This is not the right prescription. So I'm going to call your doctor and talk to him and see if we can change it around, because I know you. And having a concierge pharmacist actually allows you that flexibility, and you work more closely with the patients, because what I see in the, drugstores, the CVS drugstores, the Walgreens, they are running back and forth and around and about. They don't have time to talk to you. They have the consultation thing there, but they don't have time to really explain and talk and answer your questions. So how often should we actually look at our medications and our supplements and ask those questions?
That's a great question, Karen. Ideally, you should probably have what I like to call, I call it an analysis, because you're analyzing what you're taking, medications and supplements. At least every 6 months, you should sit down if nothing has changed. But if you start something new, you should do an analysis. If you stop something, you should do an analysis. If a dose changes, you should do an analysis, because we want to see how things have changed, what's working, what's not. You can develop tolerance to medications. I hear patients tell me all the time, I've been on this for 10 years. Well, then I start looking at their profile or their medication list, and they're on 3 different things to treat the same condition. And so, yes, that's sometimes dependent upon the condition. It could be that vigorous that they need to treat it that, but it could have been medication number 1 quit working, and physician just added number 2 and then number 3 along the path. And that happens a lot. We just keep adding and adding and adding.
Yeah.
Now, I look at it, if we're adding something, what are we taking away?
Exactly.
What needs to go? Because you don't need to be taking, the average person takes about 13 different medications / supplements a day.
That's no, I'm sorry. That just does not compute for me in any way, shape, or form. And indeed, it's like you say, the doctors and the nurses in the doctor's offices forget to take off if a supplement. So again, my folks, mind you, I knew nothing, which is why I was open to the possibilities, which is what it's all about, leading an awesome life. But it was interesting because we had the visiting nurse come, and she had the list of medicines that my folks were supposed to be on. And she'd go through the list, and I said, no, we're not doing that anymore. And she said, but it's on the list. And I said, no, he replaced it with that. Well, that's on the list too. And I said, no, this was the problem. It wasn't working. So we replaced it. So I took that off the list. So you can tell the doctor would show up the next time. It was never changed, but I had the freedom as the daughter to be able to say, this isn't working. What else is possible? That showed up. But again, it was through the doctor. I probably should have gone to the pharmacist for that.
The good thing is you took charge, and at least you got your parents not taking that stuff, even if it was still on the list.
Yeah.
But you got it, what they were consuming was better.
And knowing, again, feeling confident enough to ask the questions. And sometimes it's simply common sense. You asked it this way, this is what was done. So obviously what was there before is no longer working. So we're going to take that away. Why are we filling them up with more medicines or supplements that are not beneficial to the overall body? And again, one of my family members sat down and said, yeah, I have 13 supplements that I take every day. And I'm saying, why? But that's me. I'm always questioning, like you, always researching, always questioning and looking for answers. And this is what people listening today, looking for tips to find a better way, to feel better about themselves, to be healthier in every aspect of their life. That's what awesome life is all about. If you are sick, if you are feeling miserable, then it's time to look for resources and ways to feel better without destroying yourself with drugs or alcohol or habits that are not beneficial or mindsets that are not working, and opening that up. And that's what this program is all about. So Melissa, our time is getting to a close here, but I can't thank you enough, Dr. Melissa. I apologize. She is Dr. Melissa, and that's how she goes. And it's wonderful. How can people find you? Because I think more and more people need concierge doctors and concierge pharmacists, which I've never heard of before. And that's so important. How can they find you?
So the best way is to go to my website, drmelissabalizan.com. And I know Karen will put it in the show notes for you.
Absolutely.
So that you can find it. But those listening, my last name is spelled Balizan. And you can find different things on there. And I know that we're going to offer you a symptom checker that'll be in the show notes.
Oh, yay. Yay.
So you can put in, the link is a bit.ly link, and
I'll put it in the show notes.
She'll put it in the show notes because I wanted to shorten it. I didn't want to be very long. So we'll put it in the show notes. But what I put together for you is a symptom checker, because what symptoms are you having? And we want to make sure that you're not just masking your symptoms with medications and or supplements, so that you can get to the root cause of the problem and eliminate things that aren't necessary for you, because you shouldn't have to be taking 13 pills a day, 13 different, let me rephrase that, 13 different medications / supplements. So 13 drugs. That could mean you're taking 20 some pills a day, because you might be taking them twice or 3 times a day. That's the average person takes 13 different named things a day.
And that could be like vitamin B complex, vitamin E, vitamin C, vitamin, and if it's a vitamin, it must be good. Yes.
No. Just because it's a vitamin, just because it's natural, just because it says it's healthy for you, doesn't mean it's all good for you, because it still goes in your body. Your body still has to react to it. How is your body going to react? Does it affect your liver? Does it affect your kidneys? Does it interact with other things? There's a lot. So if you're taking supplements, you're listening, you're saying, I don't take any medications. If you're taking supplements, then you should probably look me up, because those supplements aren't regulated. You could be just throwing your money away. You could be getting contaminated supplements. You could be not taking what's good for you. So why not save some money?
Exactly. I love that. And I love the symptoms checker. I think that is terrific. And everybody be sure to go to Dr. Melissa Balizan's website. And like she said, and I will reiterate, it will be in the show notes. So just go on down and be sure to check that you liked this program, because Dr. Melissa is wonderful and awesome. And also go over to YouTube and check out her beautiful smiling face as we have this conversation. And be sure to subscribe and like those, click the notifications button so that you will be notified of all future Awesome Life podcast conversations, because our conversations are for you and for everybody, to learn more, to find a better way to enjoy having an awesome life with new tips and tricks. It doesn't matter what it is. There is something to learn at all times. And my philosophy, as many of you already know, is when you stop learning, you die. So you may as well keep on learning and enjoying and have fun, have more focus, have more fun, have more financial freedom. That's what an awesome life success is all about. So before we close, is there any last words that you would like to share with our listeners, Dr. Melissa?
Yes, Karen, thank you so much. Last thing I would say is, remember, the greatest gift that you've been given is your health. And you've only been given it one time. So take care of it now, because you want to have the most awesome life that you can have.
Oh, I love that. I love that. Indeed, without health, you really have nothing. Yes?
That's right.
So thank you. And until next time, enjoy, have an awesome life of more focus, more fun, and more financial freedom. Bye-bye for now.